So, for those that are, again, wheelchair users, um, on a daily basis, you have your people that are like your spinal cord injuries, or they can have other injuries that cause them to not have bladder and bowel function. All right. So then what happens is, if you can't feel and you can't hold, how are you maintaining your bladder, firstly? So sometimes then it's either they put you on a bladder program, or you have a catheter on, or if you're functioning normally, you can void normally, so you can go to the bathroom normally, and you just need to make sure that you're cleaning properly and you do your basics and washing your hands when you're done, or before and after, depending on how strict you are. All right. So for those that are on a bladder program, it is important that the program that you establish while you're in rehab, while you're in a hospital, you stick to it. If you are going to change it, please change it under the supervision of your treatment, of your medical team and your treatment regime. So what a bladder program is, they do an X-ray or a UDS, a urodynamic study. They test what type of bladder that you have, and hence what type of program you should have. So you can have intermittent catheterization. So it means every 3 hours you put in a catheter, you drain all the pee out, and then you take it out, and then you don't have to carry a catheter bag around with you. Okay, but then you need to do it 3 hourly. So there's a schedule. So either you do it 2 hourly, every 2 hours, or every 3 hours. You need to be emptying your bladder. But it's convenient in the sense that you don't have a bag around your leg. Okay. Other people go on a condom catheter, which is basically a catheter. It's only used for males. So it's a catheter that goes over the genital area, empties, and then they empty it out. And then the last one is your normal catheter, which is the pipe that sticks and then stays around your leg. Okay. So for the people that use catheters, it is important that your timing, if you're on a bladder program, so like I said, it's strict 2 hourly or 3 hourly. If you don't, you're going to leak. Okay, and then again, you have a puddle of wetness on your cushion, right? So your timing and your amount of fluid that you consume needs to be monitored. So if the doctor says you can only drink 150 mils every 3 hours, please drink 150 mils of water every 3 hours. There's a reason they have that set standard, because it means your bladder can only take 150 mils every 3 hours before you need to empty it again. All right. Caffeine and alcohol consumption needs to be limited, because it makes your bladder sensitive. So if you take coffee in the morning, you need to limit your coffee intake, because then it means you might need to go to the bathroom sooner than you thought, and then again you leak. All right. And then the scheduling of the bladder emptying, I've already went through. Um, if you don't do your program correctly, or if you don't clean your catheter correctly, or you don't empty out your bladder correctly, then you're at a risk of getting a bladder infection, or a UTI, which is a urinary tract infection. Or if it gets worse, you can get bladder and kidney stones, or damage and failure to your kidneys, and then you're admitted into hospitals. Okay. And then I know for some people, they prefer using the adult diapers, which is also okay if you can manage it properly. So remember, if you're using a diaper, at some point it gets full or wet, you can't keep the same diaper for the whole day, because you are literally sitting in a pool of your own pee, which again, it's a moist area, it's full of liquid and water, plus you're sweating and you're in the chair, and that causes your skin to break down, and it is a risk for pressure sores. So if you're using adult diapers, you need to change them frequently, more frequently probably than catheterization. So if you know you've been playing a game for 2 hours, immediately, even if it means you didn't use it, you are sweating, you're wet, your skin is wet, you need to change immediately and dry off the skin. Because what you do is you break down the integrity of the skin, and then what happens is then the pressure area starts forming in that area. All right. And then, yeah, and then if you're on a medication and Botox injections to help relax the bladder, that's another regime that they use. You just make sure that you stick to your schedule. Those that are normal voiders, just go to the bathroom as you usually do. Okay, shouldn't be a problem. Secondly,